Surgery: if the cancer is localized to the lining of the lung and has not spread too far, surgery may be a treatment option. The main type of surgery used for a lung mesothelioma is called extrapleural pneumonectomy, EPP. In this procedure, the surgeon removes one entire lung as well as the lining of the lung cavity, parietal pleura, the membrane surrounding the heart, pericardium, and part of the diaphragm. For tumors located in different areas of the chest, different types of surgeries may be used, such as pleurectomy, decortication. This is a procedure where part of the lining of the lung or chest wall is removed without removing the entire lung. Sometimes larger pieces of the diaphragm also need to be removed. Studies have shown that EPP may provide the best chance of cure for some patients with early-stage lung cancer that has not spread. However, EPP is an extremely invasive surgery that removes the entire lung and has significant risks, including the potential for life-threatening complications. It is estimated that only about 20% to 30% of mesothelioma patients are candidates for aggressive surgical options due to where the tumor is located and if it has spread. Radiation therapy. Radiation therapy uses high-energy X-rays or other particles to kill cancer cells and shrink tumors. For mesothelioma that has invaded locally, radiation therapy may sometimes be used to help control the growth and spread of cancer cells. It is usually given in conjunction with surgery and chemotherapy to further eliminate any microscopic cancer cells left behind. There are different types of radiation therapies that can be used for mesothelioma, including external beam radiation therapy, internal radiation therapy, brachytherapy, intraoperative radiation therapy, and proton therapy. Chemotherapy. Chemotherapy is the use of anti-cancer drugs to destroy cancer cells. For lung mesothelioma, chemotherapy is most often used as a treatment option after surgery to try to kill any cancer cells remaining behind and prevent future recurrence. It can also be used for mesothelioma that has spread beyond the lungs or has recurred after initial treatment. Platinum-based doublet chemotherapy combinations are most often used and may include a drug cisplatin or carboplatin combined with drugs such as pemetrexed, gemcitabine or raltetraxt. Recent immunotherapy drugs such as nivolumab and pembrolizumab are also being studied for use in combination with chemotherapy. For mesothelioma that has spread extensively or recurred after initial treatment, systemic chemotherapy remains one of the primary treatments used along with other disease management options. However, mesothelioma is considered a very chemo-resistant cancer and the response rate to chemotherapy alone is modest, with the median survival usually being between 10 to 14 months. Using chemotherapy can help control the disease and relieve symptoms for some period of time for many patients. Photodynamic therapy, PDT. PDT is a type of cancer treatment that uses a light-activated drug and a type of laser light to kill cancer cells. For lung mesothelioma, PDT may sometimes be used in conjunction with pleurectomy, decortication surgery, or as an alternative non-surgical approach for tumors in certain areas. A photosensitizing drug is injected into the body and over the next couple of days, accumulates more in cancer cells than in normal cells. Then, a specialized laser is used to activate the drug, which then produces a reaction that destroys nearby cancer cells while sparing normal tissues. More research is still needed, but some early studies have shown PDT may provide palliation of symptoms and modest improvement in survival for select mesothelioma patients. Targeted therapy. Targeted therapy uses drugs to target specific vulnerabilities within cancer cells. Immunotherapy drugs have shown promise for some mesothelioma patients when used alone or in combination with chemotherapy. Checkpoint inhibitors such as nivolumab and pembrolizumab work by releasing brakes on the immune system to help white blood cells more effectively detect and destroy cancer cells. Anti-angiogenic drugs work by cutting off the blood supply that fuels cancer growth. Vascular endothelial growth factor, VEGF, inhibitors like bevacizumab are also being studied. Other targeted drugs are looking at molecular targets on mesothelioma cells, including EGFR inhibitors and ALK inhibitors. While responses vary, some patients may benefit from these types of the targeted treatments. Clinical trials. Clinical trials are crucially important for improving treatment of mesothelioma. They investigate new combinations or sequences of different therapies and new anti-cancer drugs. Participating in a clinical trial may potentially provide access to newer treatments not otherwise available. Importantly, clinical trials help advance the field by developing more effective, less toxic therapies. Patients should ask their doctors if any open trials may be appropriate options for their individual cancer. Supportive care. Along with treating the disease itself, palliative care focuses on symptom management to improve quality of life for mesothelioma patients. Chronic pain and breathing problems are common issues addressed through medication, oxygen therapy, or procedures to drain excess fluid from around the lungs. Nutrition, emotional support and spiritual care are also important aspects of palliative treatment when a cure is no longer possible. The primary options for treating mesothelioma that develops in the lungs include surgery, chemotherapy, radiation therapy and new targeted therapies. A multimodality treatment approach using a combination of these treatments provides the best chance of longer-term disease control and survival. However, mesothelioma remains very difficult to treat given how often it presents at advanced stages. When a cure is no longer feasible, palliative care plays a crucial role in managing symptoms and optimizing quality of remaining life. Continued clinical research remains vital for developing novel, more effective therapies moving forward.